Hello ladies and gentlemen, and welcome to another Manual Monday. Today we're going to be talking about shoulder impingement. Shoulder impingement is an issue that a lot of people struggle with. Typically it's characterized by pain at a certain point in the range of motion and a pinching sensation at the top of the shoulder. And what it's caused by is usually an imbalance in the shoulder that's causing a pinching of the supraspinatus muscle between this bony prominence called the acromion coming off of the shoulder blade. So the biggest thing that we need to accomplish is to create enough room for the head of the humerus to move properly, to glide and slide properly, and also to facilitate the proper muscles working to keep the head of that humerus moving properly in that socket. So what I'm going to do is show you 3 different techniques in sequence that we use here in the clinic manually, and hopefully you enjoy. So Mr. Sonny here has shoulder impingement here on this left shoulder. So what he's going to do is tell me where that pain begins as he's elevating that shoulder. So tell me when. Right about there, okay. So he gets shoulder pain, let's say at about 160 degrees range of motion, and he gets a pinching sensation at the top of the shoulder. So what we want to do to help relieve some of that discomfort is we're going to start off with what we call joint mobilizations. So what I'm going to do is basically work on gliding the head of the humerus inside the socket. And so we're going to start from a superior to inferior direction, and I'm going to use my body, not just my arm, to work into that shoulder. It's very subtle movements, and he could feel that movement. What I'm doing is using the web space in my hand, so as not to use the hard bony parts in my hand, actually that soft space in that web space, to glide downward. And this is superior to inferior. And then now what I'm going to do is go anterior to posterior. So we're actually going to distract a little bit, pulling that arm outwards, and then we're going to slide downwards.
That leg as straight as you can, okay?
You can see him using body mechanics with the arm straight and just basically leaning slightly into it, and I'm able to get all the pressure I need. So if you could imagine what a joint mobilization is doing. So you have a ball and you have a socket, and you have a capsule that's going all the way around this and creates an encapsulated organ. So what we're doing is now, if I'm trying to move my shoulder upward and the ball is gliding downwards, it needs space to displace into the inferior part of the capsule, right? So if there's no room, it's going to hinge upward, and then that tissue that's in this space here gets pinched. So what we want to do is create room into this inferior part of the capsule, which is going to help maintain the space here, which keeps us from pinching the supraspinatus muscle, the top rotator cuff muscle. So what we're going to do here is it's called an ART, or an active release technique. So come around this side. What Mr. Sonny's going to do is grab his elbow here. He's going to participate. I'm going to drop his shoulder down. I'm going to scoop here, and I'm going to put my thumbs together, and I'm going to pull all the slack out of this tissue. He's going to take a deep breath, and then he's going to pull that elbow across his body, and see how I pin this tissue down here and roll right back. And now come on back to neutral. Take a deep breath and blow as you pull. Pull, 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 pull. And relax, and come on back, and I'm going to pin the scapula down with my fist here, this inferior part here, and then we're going to pin down this tissue with my thumbs. And he's going to take a deep breath and exhale, pull it across, pull it hard, 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 pull, and relax. Good. And so what this does is it creates more room, so you get a little bit more range of motion. So we went from about 160, we're probably back about 170 now, 175, which is real good. And that's just making it a little more comfortable because you're creating a little bit more room prior to that tissue getting pinched on, right? All right, and so now we've done 2 mobility techniques. So what we want to do is we want to get that to hold. and we want to stabilize and get the nerves and the muscles firing and working together. So all we're going to do is have Sonny in that low position where he's got that shoulder blade tucked back and down. He's going to make a tight fist, tight elbow, good, everything's straight. And you're going to hold that position, hold it for me, hold it for me, hold it for me. And we're just going to give what we call perturbations. So we're just giving this little external input, and he's just responding dynamically and holding him, which is what the cuff's job is. So we're going to keep this going for duration. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and relax. And in between, we're just going to give him a little perturbation here where we're just kind of shaking it loose. Relax that arm, relax that arm. We're going to shake it loose. All right, now we're going to bring the arm in about 90 degrees, like a throwing position almost. You're going to hold tight fist, and we're going to hold it strong, 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 strong. Ooh, look at that muscle, boy, looks like Popeye. Hold it, 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 strong. 5, 4, 3, 2, 1, and relax. Good, good. And obviously you can do that from varying angles, and what you can really do is work on those insufficiencies. So once you get to where you're creating more range of motion, you can actually work on stabilizing that new range of motion. So once I get past that impingement point and I get more pain-free, now I can actually work and stabilize and work that dynamic stability from that new created range. So that's all we have for you today. Hopefully you enjoyed it, and join us next week for another Manual Monday. See you next time.